that you'll be hearing from today. We'll do introductions as we jump in to our sections here. But again, I'm Colleen, I'm our Network and Strategy Officer here for the health plan, and we'll be joined very shortly by Taylor and Samarine. Taylor is our Health Promotion Fellow, and Samarine is our Program Manager for Quality Improvement. And we're all very excited to talk with you today about both resources and some of the things that we are celebrating here at HPSM. As we do get going, I want to encourage folks to say hi to one another. So if you are able to use that chat, I'd love to ask folks, if you can, to pop your name and your organization into the chat function. If you're open to sharing it, would love to hear from folks as well what brought you here today. I do see a comment or a question here in the chat, and yes, Hadiba, we will be recording today's session, and also we'll be making this available to folks to watch after the fact or to share with others. All right, so I want to go ahead and just encourage folks to jump in and share more about kind of where you've joined from, and we'll continue to keep an eye on that in the chat as we go through today's conversation.
Come to the clinic today for follow-up. Patient has been seen at emergency room.
Oh, Tom, I think that you might be off of mute. Great. Well, I always need a couple of those for sure. And just again, for folks, there's a little microphone icon at the top right of your screen if you're able to mute yourself when not speaking. Okay, so let's dive in. So I wanted to really start our conversation out today with a little bit of context about why we're hosting this webinar today and kind of what we hope to accomplish in the next hour together. Really, three motivations for us for hosting this today. First, just a chance to pause and celebrate the rich and diverse community that we live in here in San Mateo County. Second, as our role as a health plan here, we want to also share a little bit of what we've been learning from that bird's eye perspective that we have as a health plan who serves 1 in 5 residents in San Mateo County, kind of what we're seeing in the data and what that tells us about health disparities that exist for our membership. And then finally, really to provide you with some takeaways, so some resources that you can actually use after today's discussion, really to support that patient-centered approach to care and really a culturally humble approach to care as well. And so we will loop back at the end of today's presentation and see how we did on these three goals. Really to kind of think about what that means for you as a participant, we're hoping that after today's conversation, you'll have a little bit more awareness about Hispanic Heritage Month, that you'll feel a little bit more empowered to really integrate some conversations on cultural perspectives with your patients and with those that you work with and care for. A third goal here, we do want to spend a little bit of time sharing more about some of the nuances of language. So when we're speaking about folks who might identify as Hispanic or Latino or Latina or Latinx, kind of where those words come from and what they can mean and how to approach conversations with folks to really understand how they identify. We do, as I mentioned on the last slide there, want to make sure that you kind of walk away from today's presentation with some resources for things that we have available to help support our member population, and really just a kind of a broader knowledge of some of the resources that are out there to continue to learn. So that is our goal for the next 50 minutes. I do want to actually start out as we dive in here to get a little bit of a feel for kind of who we've got in the room. And as we're talking about really serving a diverse population more broadly, we want to also learn a little bit about folks' capabilities around different languages. And so you're going to see a poll that just popped up at the front of the Teams window there. And do folks see a poll? It's got a little question and then 5 answers that you can select from. When I ask folks if you can, we'll just take a couple of minutes here. I'll give folks a moment here to respond. If you can just go ahead and take a look at that question and weigh in on if you are certified as a medical interpreter, if your staff are, both are, neither, or if you're not quite sure. And then if you can go ahead and hit submit, we'll give folks a moment to fill that out. Okay, well, we're seeing a number of responses here come in. Thanks to folks for filling that out. Looks like we have one attendee who does have staff in their group or their clinic who are certified as a medical interpreter, but the majority of folks, or 90%, are not. Well, that's very helpful for us to know, and we'll make sure to highlight a little bit today some of our language assistance resources. Again, those are really important, and especially if you or your staff are not certified as an interpreter, we'll want to make sure that you know how to access those today. All right, well, with that, I'm going to hand it over to Taylor. And Taylor, pass it over to you if you wanted to introduce yourself to the group and share a little bit more about our language.
Hi, thank you so much for having me here. I'm HBSM's Health Promotion Fellow. A lot of, at least my educational background is in health education, focused on Spanish culture, literature, and me personally, I identify as Latina, and there's other communities I identify with, but I feel like it's just a great opportunity to open up the dialogue and have more discussions about this. So I can get us started. Here are some common terms we hear about when we're talking about this community. I also want to keep in mind that we're approaching this from a context of identity. So it's going to be really hard to define something like this 100%, because people will interpret themselves a certain way, or there's going to be exceptions. A lot of these terms overlap, but for purposes and later on in this presentation, when we're talking about the Hispanic community, we're talking about all three of these terms. That's who we are referring to. Right, so when you hear the term Hispanic, usually we're referring to language spoken, right? Someone who has Spanish descendants might refer to themselves like this, or they speak Spanish specifically. Mind you, someone can be American born, identify as Hispanic, and not necessarily speak the language. Like I said, there's exceptions that come into each one of these categories. When using the term Latino, a lot of times we're referring to geography. So anything south of the US, this includes the Caribbean too, which is important to keep in mind. Central America, South America. It's important to consider also there's lots of countries that, that Spanish might not be the dominant language. Brazilian Portuguese is also in South America. A lot of indigenous populations that might not have spoken Spanish at first before colonization occurred, right? And then I do want to point out when we're talking about these, there really is no right or wrong way. The emphasis on this is it's always important to ask. Feel comfortable asking what patient's preferences is, and you can apply this into everyday conversation as well. But coming into the term Latinx, this is kind of the more newer, fresh perspective, a way of non-gendering the term Latino. And that being said, saying Latino isn't wrong either. You're not intentionally omitting, certain genders. Typically, when spoken Spanish, if I say Latinos, it implies that I could be referring to male and female, different genders. It's just the way that Spanish is interpreted and spoken, right? As something to note with the term Latinx, there's no way to say this in Spanish. So using Latinx requires some type of proficiency in English and Spanish in order to put the pieces together, right? And then one thing I wanted to note that I thought was kind of important to keep in mind, Latino is the only one of these terms that is directly the same in English as it is in Spanish. And then we can go to the next. Cool, so cultural humility and identity. I know cultural humility, this probably isn't the first time you're hearing this, but in the sense of research has shown that with cultural humility and approach to care, it enables patient providers trust to be built and greater communication. There's just lots of things to benefit from this kind of approach. So in terms of breaking it down into 3 little steps here. So in cultural humility, it is more, think of it more as like a philosophy. You know, we are constantly reflecting on ourselves, thinking about, you know, everyone has personal bias, identifying that and think of where it comes from. And then also taking a step back and realizing, you know, someone's going to have a different perspective than me. So it really starts with the reflection. Reflect on oneself. And then use that in turn when interacting with people, and being comfortable to ask questions about identity, about preference, because, you know, there's really no right or wrong way. The only way to know is to ask. And in turn, using that to individualize approaches to care and treatment, because one treatment's not going to work the same way for another person. It's the same way that science goes. We're constantly, nothing's 100% certain. We're constantly reevaluating and reassessing our treatment approaches, right? And then some little notes that I wanted to put here is, first, when I say this community doesn't have a phenotype, all it means to say is there's not one certain way that this community needs to look. Not all Latinx people are people of color, and vice versa. There's no certain stereotype or way that someone is supposed to look in order to identify as Latino, Hispanic. And then going against potentially harmful stereotypes about not all undocumented immigrants are Latinx. I think this also goes into, you know, if someone has an accent, someone speaks predominantly another language, it doesn't necessarily imply they're undocumented. There's lots of biases that can be harmful to this group, especially if it alters our approach. And the reason why I point out Spanish when used as an adjective typically means to refer to Spanish culture as in the country. I point this out because I feel like there is a bit of a disconnect between Spain specifically and then like all of Latin America. There's so many, this is such a diverse, rich community that it's important that we're able to distinguish that, yeah, there's differences and similarities. And then that being said, next. Yeah, so we wanted to post some resources on cultural competency. I like to distinguish cultural competency and humility. Just think of it as awareness, and then humility is the extra layer on top that involves constant self-reflection, and then just being open to new ideas and interpretation. Just accepting that, you know, there's no way we're ever going to know everything about everyone. So just being open in the process. The first source is about our class standards, so cultural and linguistically appropriate services, which is national standards for healthcare. And then the second one is a checklist when it comes to cultural awareness. I'll pass it off to Sam.
Hi, everyone. I'm Samarine Shami. I am the program manager for population health at the Health Plan of San Mateo. And today I'm just going to talk you through some of the data that we have on the composition of our membership. And really, this is just to provide you with some insight into what a large percentage the population that identifies as Hispanic or the population that speaks Spanish actually makes up in terms of our total membership. So here in this first chart, we've taken Medi-Cal. And the reason we've chosen Medi-Cal, just to sort of show you some of our composition, is because it makes up about 77% of our membership, which is, of course, very significant. And I'm going to talk through some of these slides that show us how the Hispanic identifying and Spanish speaking membership is distributed among our county. So 44% of our members identify as Hispanic, 19% as Asian or Pacific Islander, and then 13% as Caucasian, only 3% as Black, and then there's a significant number in the other unknown category. You know, as many of you probably know, if you've been in any of our conversations around race and ethnicity, much of that other unknown is a category that we would really love to disaggregate and better understand who is captured here. But for the purposes of this, just to keep in mind that 44% of our population does identify as Hispanic among the Medi-Cal population, which makes up 77% of our total population. Next slide, please. Here we've tried to show you exactly where our members who identify as Hispanic are located. So within the Medi-Cal population, as you can see, there's about more than 50,000 members who identify as Hispanic. And what we're looking at here, just to break it down a little bit, is that this chart shows you density. So the darker the color, basically, the more the population that kind of lives there. So in those darker areas, we have a significant population of Hispanic identifying members. So this slide is showing you those members and where they live. And it kind of affirms what we already know in terms of where they live, that many of them live in East Palo Alto, Redwood City, northern part of San Mateo County. And the other thing to remember is in those light blue areas, although those are light blue and are not perhaps as significant in terms of density, there are significant members who do reside in those areas too. And the HPSM primary care providers, which is overlaid here on this chart in the yellow, is really a distribution of some of our primary care providers and their locations, which seem to be consistently along the coastlines. And this just is something to illustrate how our county is distributed, both in terms of providers as well in terms of Hispanic identifying members. Next slide, please. We also wanted to sort of have an understanding of where our Spanish-speaking members live. And although this was very similar to the previous slide, it is interesting to see that there's still a large sort of distribution or dispersion of some of our members in the South. Even though that is a light blue, it's good to always remember that despite the densities along the coastlines, those are not insignificant numbers. Next slide, please. The other thing that we wanted to kind of highlight to you is in terms of our Medi-Cal membership, we have seen a significant increase in the membership between 2019 and 2020. And our analysis shows that, that as we expected, the membership itself has gone up. However, what this slide also shows is that the percent of membership by language preference has remained pretty much consistent. So, most of our members do speak either English or Spanish, and that, of course, the other languages make up some smaller percentages of the total preferred languages. All right, I'm going to bring it back to Taylor.
All right. In focus more on our metrics. If you're not already familiar, HPSM measures quality and as a way for us to identify health disparities, and this is in a variety of categories: language, how old you are, gender-specific data, and as well as race and ethnicity. Something that we want to highlight among our Spanish-speaking members is that in terms of mammography, going in for pap smears, cervical cancer screenings, adolescent immunizations, and going in for routine well-child visits, these groups tend to exceed compared to the overall HPSM membership. Similarly, we distinguished Hispanic identifying members in general. Overall, this group is still with mammography and cervical cancer screening and well-child visits. It's just historically, they're doing very well in these categories. We have results of our 2020 population needs assessment coming up soon, and we'll make that available on the Provider Learning Lab. So definitely stay tuned for that. You can check it out at the link. You can go to the next. Cool. So I think this goes without saying. Something it goes for language barriers. This is with any language in general among our membership. It poses a barrier, especially when there's someone in between, but it's our goal to minimize this as much as possible, right? As much of a third of our membership speaks Spanish, and even more could speak Spanish as a second language. There's a lot to consider. So this kind of goes hand in hand with there's always an inherent need for people who are clinicians, practitioners, and also certified medical interpreters. Kind of where it separates being a native speaker and a certified medical interpreter. There's so much to learn in terms of any language, in terms of medical knowledge, and being able to communicate that to someone else in a way that's easy to understand takes a lot of training and skills. So having the certification also ensures that the individual is trained in like patient privacy. There's a lot of things to consider. So that's kind of why we strongly discourage family members, friends, especially minors, to be used as interpreters, because it's unfair to them, and then two, we want to make sure that they're getting a gold standard of interpretation. We also added the resource of our language assistance services here on the side for you to reference, because we will be sharing the slides later, as Colleen mentioned. And then coming into vaccinations, overall HPSM, our vaccination rates as of currently are 25% lower than the general population of San Mateo County. So we wanted to talk a little bit more about that, and I believe Colleen will break it down for us.
Well, thanks so much, Taylor. And before I do break it down, I also saw a question come in the chat for the information on the translation line and language assistance services. And so I think if a member of our team can pop in the link to the language assistance program page there, I think we can help answer that question. And definitely that's one to bookmark to make sure that you're familiar with how to request that. That is a free and important benefit for HPSM members. So yeah, just to kind of double click here a little bit on that last statement there about what we're seeing in terms of vaccination rate gaps. I do want to provide a little bit of data and context on this one, and then also we're going to talk a bit about some resources that you can have access to as HPSM providers. One, just, there's kind of two stats here. The first is the top line of some really high vaccination rates here in San Mateo County for the population overall. Bay Area, again, kind of leading the nation right now in terms of low COVID cases and high vaccination rates. And we're really seeing that here in San Mateo County, where we have over a 94% vaccination rates for those who are eligible over the age of 12. And again, something to really celebrate and that we're very, very excited about. The piece of this, though, that adds a little bit of really important nuance is that the vaccination rate for those who are eligible for Medi-Cal, so HPSM members, as well as our ACE members, are making up a large portion of those remaining folks who are not yet vaccinated. And so as we're really trying to get closer to 80% of the general population, so all ages of vaccination rates, and so we're really trying to focus on health equity so that those who are impacted most by this pandemic have access to that life-saving vaccine. Changing or narrowing the gap that we see between these two numbers is really important for us. And so I do want to, again, encourage folks, if you want to go deeper into any of this data, we're going to share a little bit of it today. We also have a deeper dive into this in our upcoming fall 2021 provider newsletter that will be coming out soon. So I do want to put in a plug for that if you want to go a little bit deeper into the numbers there. But we are going to take a quick look at a couple that are important to us as we're really trying to understand where is this gap coming from and what can we do about it. So first, I'm going to take a look at just what the vaccination rates look like here by race and ethnicity identification for our members. So first, just some orientation to what's on the slide. Each bar here represents the percentage of members who identify with that race or ethnicity who've been fully vaccinated. That's the green bar. Partially vaccinated, that's the yellow bar, or not vaccinated at all, that's the red bar. If we highlight here our members who identify as Hispanic, that's the orange bar that should have just popped up there on your screen. You can see that about 65% or so of that population is at least partially vaccinated, but that is below both our county average overall, that 94.1%, and it's also below the HPSM average of 70%. So that is kind of an area of focus. Now, there might be a few things behind this gap. Again, and we really don't want to make assumptions, so we want to share what we know and see what that can teach us about where we go next. So one of the factors that contributes to that lower vaccination rate for our Hispanic identifying population is age. And so on average, HPSM members who identify as Hispanic have an average age that's about 5 years younger than the average age of our total population. So they skew a little bit younger. And as we see in this second chart, vaccination rates are lower for our younger members. That's true also kind of overall for our county and nationwide. Again, vaccines were rolled out earlier for those in higher age brackets. And we've also just seen some additional trends kind of contributing to lower vaccination rates around younger folks. And so some of that difference that we're seeing for our Hispanic population may be driven by that kind of 5-year age difference in the average age of our members in this subpopulation. But now age doesn't explain the entirety of kind of what's potentially going on here. We do want to take a look as well at language preference. One of the things we learned kind of early in the pandemic, and we're still seeing some of today, is just language accessibility can be limited for some of the materials, both about kind of information about the vaccine, if I have questions that I want to get answered, and then also even with the scheduling systems that are used for folks to sign up for an appointment, that may not be available in all languages. Now, having a language preference other than English doesn't necessarily correlate to lower vaccination rates. As we see here on this slide, again, same kind of setup here where the green bar means fully vaccinated, the yellow bar means partially vaccinated, and the red bar is unvaccinated. You can see here that kind of second and third bars over from the left for our members who prefer Chinese and Farsi, as well as for our members who prefer Tagalog and Vietnamese, their vaccination rates are actually higher than the blue line. They're higher than our HPSM average rate. Still lower than the overall county rates, but those are actually some higher vaccination rates. But we are seeing that our members who have a preference for Spanish do have lower vaccination rates, both partial and complete, both versus the county as well as overall. So there's a lot more data on vaccination rates among our members, and we've kind of done, again, some more work there to take a look at that by medical acuity, by geography, and some other factors that we won't go into today. I will put a plug in again for that provider newsletter that's coming out this fall if you would like to look a little bit more closely at some of this data. But we've been really using this data as well as direct input from our community partners and in some cases directly from our members to really try to understand kind of what's behind this gap and home in on 6 barriers that we think are behind some of this gap that we're seeing. So I do want to just talk a little bit about kind of what those 6 barriers are and highlight then some resources for what you as a provider have access to that can really help in this fight to close this gap of this vaccination disparity. So first, now on the top left here, we want to just kind of call out that it might seem like vaccination information is on the radio constantly, on the news constantly, on billboards, that's kind of really out there permeating the air that we breathe, but we're still really hearing from some members and from some community partners that they may not have that basic information about where to get the vaccine. To try to address this, we're actually maintaining a central website that provides information on local events that you can share directly with your patients. Now that link is going to be provided in just a moment here in these slides, and we'll also be sending that out after today's presentation. Now, that said, if the vaccine is not actually easily accessible from your home, from your work, or from other settings, that can be enough of a barrier that means somebody doesn't actually get the vaccine. As Sam shared in those geographic distribution slides, what we really saw there is we do have members really spread out across the full county. Some of those areas are really close to dense areas of a lot of providers. Those were all of those little yellow dots that you saw for our primary care providers. But some of those areas are further from a healthcare setting. And so here I really want to remind folks that HPSM members are eligible for our transportation benefit to medical appointments, and that includes to vaccines. So again, we will be providing that link and follow up as well for information on how members can make sure that they can schedule a ride to get to that appointment. Third, we talked about this a little bit already, but language accessibility definitely can be a barrier. So we know that some of those scheduling websites. They're now available in a few more languages than they were at the beginning, but really a lot of scheduling websites were available only in English or just English and Spanish early on, and not all are translating all of their materials. And so we do really want to encourage providers to use the translated vaccine confidence materials that we've produced. Those are actually translated into 11 different languages, also available on our website. And again, we will link to that today and in the materials that we send out. And then it's also really important, as Taylor highlighted, to make sure that you know how to access our language assistance services. How do you schedule someone to actually either assist with kind of on the phone interpretation or in person, including ASL. All of those are available, and we want to make sure that you know how to access them. Fourth, technology accessibility. So we really saw some signs of the digital divide happen, especially early on in the pandemic. A lot of the member calls that we were receiving were folks who were not able to sign up for some of the more high-tech systems that folks were using to really sign up for appointment availability. I will just say that, again, while there are a lot of options out there for getting a vaccine, not all of them are intuitive or available in a very accessible format. And so we do want to encourage you to ask if your members would like assistance signing up for a vaccine, or even encourage them to call the HPSM customer support number on the back of their HPSM card. Our staff are also assisting folks with really helping them to find kind of where can I go? Can you actually help me get set up right now in the moment to make sure that I've got a place to go get the shot? And then finally, two more that I want to just highlight. Mobility barriers. We do know that a number of our membership are either have mobility barriers or maybe homebound, and so there are ways to request a home-based vaccination. You can do that actually through My Turn today. There's a way right in My Turn to request a home-based member vaccination. You can also directly schedule with our partner on this, HR support for HPSM members. And so again, we'll be providing some more information about how to access that. But just do want to really highlight that that is a resource that's available for folks who maybe have mobility issues that prevent them from being able to travel into an outside site for the vaccine. And of course, no conversation about vaccine rates and kind of closing the gap would be complete without a discussion of vaccine confidence. And here, really, there are, I want to just kind of emphasize a few key things. We know that there are a lot of different reasons why individuals may have well-founded distrust of healthcare settings. They might have information, misinformation, or just too much of it that they're really trying to sort through. And it's important to kind of go into these conversations. There are a lot of tools available that we're gonna link to here for kind of how to prep yourself, how to prep your staff, how to kind of recharge and re-energize for having those conversations with folks. But I just want to really highlight that it's important to kind of make sure we're not going into those conversations with assumptions about where people are coming from. There are many different reasons behind why someone might have confidence issues today. And so we've provided some resources, again, that we'll link to here that can really just help you and your staff with some very tactical things like talking points in different languages, some answers to some frequently asked questions, and other resources that you can actually print out and use directly in your clinic. So again, these are kind of those links there. That first one that I've highlighted again is where do I go for that central source of truth? If someone is interested, engaged, and wants to find a vaccine appointment near them, this link here at the top will help them do that. Second, there are some resources really for you as a provider. So if you've not yet become a vaccinator, to vaccinate folks in clinic, that is a really core part of helping to build that trust. We know that trusted relationship that you have with your patients can really be influential in helping to build that vaccine confidence. So I want to encourage and support you in doing that. And beyond just providing you with some materials you can print, I did want to put one last note in here around our recently launched primary care vaccine incentive program. And this is a program that we actually just launched in the last week to really provide some funding for our primary care providers, both for vaccine outreach and also to support them in being vaccinators in their clinic. So the link again is included here, and we will share this after today's presentation. So I'm going to just summarize here a little bit. So key takeaways from all of this work and a lot of that data that we just shared, really kind of 2 points that I want to kind of sum up all of that into. One, in order to really kind of close this gap, what we've really been learning from our community is that vaccines need to be radically convenient. So radically convenient to your work, to your life, to the constraints of your life and your needs. And we really need to meet members where they are to ease whatever combination of barriers they might face to accessing healthcare. And second, that we really need to help build up that vaccine confidence. Again, vaccine concerns are not uniform. There are many variations here, so we need solutions that can address that. We do know from data, and this does continue to evolve, but the best data that we've seen really shows us that conversations with trusted sources like providers, family members, and peers, those can really play a pivotal role in building that confidence. And so want to make sure that we're supporting you, our providers, as that trusted voice in having those conversations. Right, I'm going to hand it back now to Samarine to kind of pull back a little bit and beyond just vaccines, look at some broader resources and programs that we also want to share with you today.
Hi there. So, we do a pretty in-depth analysis of some of the chronic conditions and just generally how our Hispanic identifying and Latino, Latinx members are facing. So we have plenty of programs in place that kind of cater to some of their needs. So the first one I'm going to talk about is Baby and Me. I'm sure many of you are familiar with our incentive program, this is a $50 Target gift card for timely prenatal and postpartum care. So they get a $50 gift card for each of those visits. That one, that's not the only thing that Baby and Me does. We also provide important resources for many of our members. And, of the sort of 1,000 members that were pregnant this year in 2020, for example, more than half identified as Hispanic. So, this is definitely a program that directly caters to some of those members. Our complex case management program is, you're assigned to a case manager, and then the case manager will then call you on the phone to help solve some medical problems, help them meet their healthcare goals, teach them about any health issues and self-care, and connect to any resources that can help in terms of condition management. There's also the ability to help set up a treatment plan and then follow through on that treatment plan as well. Other programs that would be helpful for some of our members are our self-management programs, such as our asthma program. And our asthma program provides direct calls to some of our members to discuss their medication. It also directly communicates with your provider with the member's provider in case the member has asthma. And for our pediatric members, we are also now beginning to directly refer our members to the county home visiting program. And many of our members within who have asthma do identify as Hispanic. The Diabetes Prevention Program, or DPP, is also something that you may have heard about in the community. And that the DPP program is now active, and we have 2 main vendors that our members can access and help manage their diabetes. We also have health education tips that are available on hpsm.org. And another program that will shortly be coming up is our incentive program for well visits for our members who are teens. So look out, and you will hear about that pilot program that is going to start in one of our clinics. But as Colleen mentioned, our membership is very young, so we're looking forward to being able to provide that incentive card for these members to encourage them to go in for their well visits. And of course, our language assistance services, and here is the link for that. And you can find out more about everything that HPSM does to ensure that language services are available to our members. And of course, as mentioned by Colleen, becoming a COVID-19 vaccinator is one of the key ways that we believe that we can help our Hispanic and Latino, Latinx members in our HPSM population. Next slide.
Cool. So this, as we're kind of nearing to the end of this webinar, we're talking about programs that benefit the Hispanic community. A takeaway is just different ways that you can, as yourself individually, can act to support this community. You know, it's really important that you feel comfortable starting conversations about identity and preference, because it's the only way to know. Another example might be knowing someone's gender pronouns. The only way to know, if they don't already tell you, is to ask. It's a respectful way as opposed to assuming. Definitely a better alternative. You know, at the end of the day, we're all human. We're all bound to make a mistake, and it's okay in the process, right? If and when it happens, it's you know, we can always just apologize, express the want to know more, and then kind of go from there. You know, at the end of the day, we're all kind of learning as we go. You know, I encourage you to feel empowered to open up new conversations with your patients, because, you know, I can acknowledge that it is something that's challenging, but and you might sense a little bit of discomfort, but that's something that's really important in growth. It means you're getting outside of your comfort zone, so then you're headed on the right path. If there's anything that I want you to take away from this webinar, is just being able to understand that individuals experience healthcare differently. This is based on perspective and cultural values. And sometimes a good way to start is by acknowledging it. You know, an example might be something along the lines of, hey, I want to learn more about you and your experience to make your care better. I understand that we all experience healthcare differently based on cultural values, perspectives. So if there's anything that I need to know to accomplish that, please let me know. Kind of like opening it up, encouraging patient provider communication has a lot of potential to help provider and patient experience, right? And just an emphasis on a one size doesn't fit all. There's going to be treatment that works differently from person to person. So it's never safe to make any culture generalizations, because you will find exceptions, and it's not going to always be, it's not a reliable way to approach treatment, right? And then something to keep in consideration for language preferences, you know, something you might want to consider, when you're working with someone, just start off like how you talk to anyone else. And then when it comes down to you want to get an assessment of English proficiency, you could ask an open-ended question like, why are you here today? And based on their response, or if communication becomes difficult, if they're only giving yes or no responses, maybe then you can decide, okay, do you need an interpreter? Or, you know, there's always so many reasons that could be happening. At the end of the day, our goal is that you know when and how to request interpreters. We always want, preferably, we encourage members to schedule an interpreter upon making the appointment. However, should a situation arise when you're in the middle of an appointment or the patient is there in the office, just know you can call interpreter services 24 hours a day and get an interpreter over the phone to help out. Yeah.
Thanks so much, Taylor. And just taking a quick look at time, for our last portion of our discussion today, we do want to save some time for some Q&A. And I want to just check here, make sure we're presenting our slides. Can folks see a PowerPoint still?
I can see it.
Great. I've got about a 50-50 success rate with actually presenting the right document. So thank you for the verification. I did want to just save a little bit of time for some Q&A, and also I'm hopping back over to our chat here because I actually see a number of questions came in through our chat, as well as some great answers. So I'm going to just kind of give a quick verbal summary of what we've seen come in there through the chat, and then please do think about other questions that you might have on any of the content today. So first, I think there was a question around certification and kind of how to actually get certified as a translator. I know Michaela and Teresa, I think you both jumped in here with some helpful links for folks to help folks actually get certified. But I'll hand it over. I don't know, Michaela or Teresa, if you wanted to say a little bit more about kind of tips and tricks for navigating becoming a certified interpreter.
Sure. So we don't offer credentialing at HPSM, but our vendor does use the Commission for Healthcare Interpreters and the National Board of Certification for Medical Interpreters for their interpreters that we use. So if you're looking to get credentialed, those are two really great options. But if you do choose to get credentialed and use the interpreters in your office, you do have to notify us so that we have that on file, and just making sure that we're providing culturally and linguistically appropriate care.
Thanks, folks, for the questions on that and the interest. And we'll follow up with our email after today's session as well with some of those links and the email address that Michaela provided there in the chat for folks to have that handy. I think there was also a question as well about complex case management and how to access that. And again, Michaela, thank you for sharing our link to that there for that program. I don't know if we have others from our ICM team on the call today, but I'll just hand it over. I don't know, Michaela, if you wanted to say anything else about the complex case management program, and I can also say a few words about kind of the scope of that and how to access them.
Colleen, if you want to take that one over. I don't know much about it, but yeah.
Yeah, absolutely. I'll just put in a plug here again for that link that Michaela shared. Our case management team, we are a pretty lean case management team in terms of kind of our caseload per individual, but we do have some really wonderful folks in our integrated care management team who specialize based on level of acuity of our members. So that form there that's available from that page is really the first step in that process. That complex case management referral form is the first one to send out, and then fax in to the link that, or the fax number that is included at the bottom of that form. There's also an email number. And that will be your first point for conversation for connecting them with someone here at the Health Plan of San Mateo for case management. What that can look like might be a combination of connecting them to programs, including some of the ones that Sam Marine highlighted there, some of those specialty programs that we have available. But there are a lot of other community partners that we work with here in San Mateo County. So sometimes just having that point person who can help direct you to really what's available can be an important step. So do want to put a plug in for that program. I want to make sure I'm not missing any other links here. We've got a question about data that from Martha as an LMFT. Wonderful. We love LMFTs, and thank you for joining us. It's such an important part of our network. Martha, I actually don't know that we have that data handy, although Sam Marine and other folks from our population health team, please keep me honest on this. I think just an interest in the percentage of Latinos or members identifying as Hispanic who are accessing mental health today.
Yeah, hi. So this is Sam Marine. As we said, we do quite a bit of a deep dive into some of the chronic conditions that our members face. Some of the areas within mental health, and I'd love to hear more about where you'd like to go, and you're welcome to email me. But would you like to know about particular conditions? We have it broken down by specific conditions. One of the areas that we have looked at in a little bit more depth would be maternal mental health, and then what happens to our members who are screened positive for that. We can also break it down if you're interested in either a particular condition, how many of our members face that, and also where they're going in terms of either therapy, psychiatry, and things like that. The only thing I would say is that we rely on providers to code those things, as well as rely on other resources in terms of where our members are going. Our data is not 100% accurate, but that is the case, with data itself. So, but we can possibly, if you are interested, particularly in a condition, provide you with much more detail about how many of our members face that condition, and then kind of what happens to them within the course of that disease. So, feel free to reach out to me. I know Teresa just gave you her email as well. Either one of us can help you out. And just to plug, while we're here, the population needs assessment is what I'm referring to when I say that we look at an in-depth view of our membership. We have completed the population needs assessment for 2020, which is the link that was provided to you. We are also going to be spreading the word for the population needs assessment for 2021. And of course, each year it just we always say our data gets better and better, and we get a better handle on what's going on with our population. So I encourage you to look up that resource. At the moment, it might not have specifically what you need in terms of a specific condition or anything, but we can always combine. You'll have a perspective on what our data looks like. And then if you have specific requests that helps with your work, we can definitely look into that. So I'll include my email as well if you want to get in touch with me directly.
Great. Thanks so much. And I will put in, just as we're sharing emails, one last one to share as well. I want to make sure folks are aware of the psinquiries@hpsm.org email address. That stands for Provider Services Inquiries. Well, I know that we've shared kind of a couple of key points for specific topics. Connecting with Michaela about culturally and linguistically appropriate care and language assistance services, connecting with San Marino about our population needs assessment and some of that data. For other kind of broad questions about how do I access this program, or have an area to kind of learn more about, I do want to encourage folks to use that general inbox of PS inquiries at hpsm.org. Just as we're kind of closing up here, I think we do have time for probably one last question before we wrap today. I'm going to ask for phone a friend here a little bit ask for help if there were any questions that I missed in the chat, or if you are joining us by phone, please just jump in verbally if there are any last questions for today.
I think you got all of the emails in the chat, Colleen.
Great.
One last one, if you are looking to submit a request, I'm going to put it in the chat, but the correct email for that is interpreters@hpsm.org.
Thanks, Michaela. So I think then our only last question here before we wrap today is just to check in and see how we did. So want to again really thank folks for spending their lunch hour with us today. Hope we covered some of what you were hoping to get out of this hour. And again, that general email address that I just mentioned there is also the one that's on the slide here. That's psinquiries@hpsm.org. If you have additional questions, ideas, or suggestions for us. So thank you again for joining us for this celebration of Hispanic Heritage Month, and thank you for all that you do to serve our community. Take care.